Hi everyone, welcome to another day of our class. Today we will look at the disorders of the cardiovascular system, and we'll start with cardiac tamponade. Another name for cardiac tamponade is Beck's triad. Beck's triad or cardiac tamponade is a medical emergency. So once you identify the signs and symptoms, which we will discuss later on in the class, you have to notify the provider immediately. So it's one of those things when they ask you, what will you do? Your answer is notify the provider immediately. Cardiac tamponade is the accumulation of blood or fluid or exudate in the pericardial sac. The causes can be both acute and chronic. So for acute, we have motor vehicle crash or accident. Stabbing is another cause, and procedures such as coronary artery bypass graft can also cause cardiac tamponade. So for chronic causes, we have pericarditis, so inflammation or infection of the pericardial sac. So for the signs and symptoms, and new people in the class, we really don't like memorizing long lists for signs and symptoms or assessment. We try to critically think out what the signs and symptoms of an illness will be. And how do we do it? We look at the definition of the illness, so the pathophysiology. We look at what they told us the causes are, then we will be able to come up with signs and symptoms as well as treatment. So having said this, I'll give us like 3 minutes to come up with signs and symptoms of Beck's triad, giving the definition, giving the pathophysiology as well as the cause. All right, welcome back. I saw some people writing chest pain. I saw shortness of breath. I can also see decreased cardiac output, and those are also true. So in addition to these signs and symptoms, there are 3 specific signs and symptoms that are central to cardiac tamponade. And I saw someone wrote one of them, JVD. So JVD, jugular vein distension, hypotension, and muffled heart sound are specific signs and symptoms to cardiac tamponade. JVD, whenever there is accumulation of fluid in the body, the first gold standard sign and symptom you will see is enlargement of the jugular vein, or big jugular vein, or jugular vein distension, whichever you will remember, but it's going to be large. And the low blood pressure kind of makes sense because there is an accumulation of fluid or blood in the pericardial sac. It will cause the pump that pumps out blood to be weak, leading to less cardiac output. So this is going to cause hypotension. And you will see changes such as the blood pressure going from the normal 120/80 to 110/80. So the systolic will drop by 10 millimeter of mercury. Someone wrote explain a muffled heart sound. So I will do that with an example. It's gonna be you are holding a phone and the phone is ringing when it's on your hand. Then you put it in water. Let's say put it in a leather bag, put it in water, and have someone call the phone. The phone will be ringing, but you will not hear the sound because of the fluid, because it's in water. So it's the same way when you listen to the heart before this accumulation in the pericardial sac, you will hear the heart sounds. But when you listen to it after the accumulation of fluid in this pericardial sac, the heart sound will not be heard. What do we think the treatment will be? I saw some people writing something already. Somebody said cardiac monitor. Yes, whenever there is something going on in the heart, we want to put cardiac monitor to see what is going on. So when we place cardiac monitor, the result we will see will show uneven and short R. So the QR complex will be short and uneven. So like this picture I'm showing you guys right here. Look at how this R is. This is where it is. Look at where this other R is. So this complex will be short and uneven. Someone also wrote removal of fluid. So yeah, they remove the fluid and it's called pericardiocentesis. In pericardiocentesis, a catheter is attached to a drainage system. And when a catheter is attached, we have to assess the site as our nursing intervention. We assess the site for infection. We assess the drainage type as well as the speed. So for the drainage type, we want to know if it's serious or sanguine or what is going on, and we document it.